Hello, everyone, and a very warm welcome to you. Thank you so much for joining us today for our webinar, Medication Mastery, Staying Safe, Independent and Confident with Your Medicines. My name is Beck Minahan and I work with Catholic Healthcare's Home and Community Services team. I have the pleasure of coordinating our monthly webinar series and I'll be your host for today's session. Whether you're joining us because you take medications yourself, support a loved one, or you're simply interested in learning more about healthy aging, we're delighted to have you here with us today. Our hope is that today's webinar leaves you feeling a little more informed, a little more confident, and perhaps with one or two practical ideas that might help make managing medications easier. Before we begin, just a few housekeeping points. Today's session is being recorded and we'll send a copy of the recording to everyone who registered. Your cameras and microphones will remain off throughout the webinar, so please feel free to sit back, relax and enjoy the session. If you have any questions at any stage, please pop them in the Q&A box. We'll leave plenty of time towards the end of the webinar to answer as many questions as we can. And remember, there are no silly questions. If you're wondering about something, chances are somebody else is wondering the very same thing. So before we begin, I'd like to acknowledge the traditional custodians of the lands on which we all meet today. Although we're joining from many different communities across Australia, we're gathering today with a shared purpose to learn, connect and support one another. We pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples joining us today. Thank you. Today's topic is one that affects almost every older Australian. For many people, medications are simply part of everyday life. They sit on the kitchen bench, beside the bed or in the Webster pack, or by the kettle. Taking them becomes part of the daily routine, much like having breakfast or making a cup of tea. In fact, if I asked everybody listening today to put their hand up if they take at least one medication every day, I suspect most hands would probably go up. Medications play an incredibly important role in helping people stay healthy, manage long-term health conditions, and maintain their independence. Yet, despite being such a common part of everyday life, many people still have questions about them. What exactly is this medication for? Do I still need it? Could it be contributing to how I'm feeling? Am I taking too many medications? How do I make sure I'm managing them safely? These are all really common questions, and they're exactly the sort of things we'll be talking about today. Today's webinar isn't about telling anyone what medications they should or shouldn't take. Those decisions should always be made by your doctor, with your pharmacist, with your doctor or your healthcare team. Instead, our focus today is on helping people better understand their medications, recognising when something has changed, know what questions to ask and understand what supports are available. Because taking medications safely is only one part of the picture. The bigger aim is helping people feel confident, supported, and in control of their health. So to help us explore today's topics, we're joined by three wonderful guests. We have Michelle Excel, one of our registered nurses, who many of you may recognise from one of our previous webinars. Michelle is joining us again today to help us explore the health side of medication management, including why regular reviews and asking questions are so important. We also have our occupational therapist, Katrina Bay, who will be sharing practical tips to make medication management easier at home. And later in the webinar, we'll be joined by Sharon Dillon, one of our care partners, who talk about the supports available and how people can access help when needed. Thank you all again for joining us today. And so let's get started. To begin our conversation, I'd love to hand over to Michelle now, our registered nurse. Michelle, medications are such a normal part of life for many older people that I think we sometimes forget just how important they can be. Could you start by talking about the role medications play in helping people stay healthy and independent as they age?
Thanks, Beck, and hello, everyone. It's lovely to be here with you today. I think one of the most important things to remember is that medications are there to support our health and well-being. While many of us think of medications simply as something we can we need to remember to take each day, they are often helping us live healthier, safer, and more independent lives. Many medications help manage long-term health conditions such as high blood pressure, diabetes, osteoporosis, heart disease, arthritis, and chronic respiratory conditions. Others help control symptoms such as pain or support recovery following illness or injury. When medications are working well, we don't always notice the difference they're making, but often they're helping prevent complications, protecting our health and allowing us to continue doing the things that are important to us. What I often remind clients is that the goal really isn't about taking medications. The real goal is what those medications help make possible. They help people stay well enough to continue living the life they want to live. Of course, medications are only one piece of the puzzle. Good nutrition, regular movement, sleep, social connection, and ongoing healthcare support all play important roles in healthy aging as well. But for many people, medications are a valuable tool that work alongside those other strategies to help to support health and independence.
I really like that way of looking at it. It's not actually about the medication itself. It's about helping people continue doing what matters most to them. One thing we hear quite often from older people is that they seem to be taking more medications now than they did 20 or 30 years ago. Why does managing medications often become more complicated as we get older?
That's a really common experience, Beck. As we age, many of us find ourselves managing more than one health condition at the same time. Somebody may be living with arthritis as well as diabetes. Another person may be managing heart disease, osteoporosis, and also chronic pain. Each condition may require a different treatment approach, and over time, medications can gradually be added to support those needs. Sometimes medications are prescribed by different healthcare professionals. A person may receive one medication from their GP, another from a specialist, and perhaps additional medications following a hospital stay or health event. Over the years, it can result in quite a complex medication routine. Healthcare professionals often use the term polypharmacy, which simply means taking multiple medications. Polypharmacy itself isn't necessarily a problem. In fact, many people benefit greatly from taking several medications because each one is helping to manage a different aspect of their health. The challenge is making sure that all of these medications continue to work together safely and effectively. As the number of medications increases, so too does the possibility of side effects, medication interactions, duplicate medications, or confusion about what medications are being taken and why. That's one of the reasons regular medication reviews are so important. They provide an opportunity to take a step back and ask some important questions. Does every medication still have a purpose? Is it still the right medication? Is it still providing benefit? And is there anything that might need adjusting? One of the simplest and most valuable things people can do is to become a little more familiar with their medications. You certainly don't need to memorize complicated medication names, but understanding what each medication is for can make a real difference. It can help you have more meaningful conversations with your healthcare team and feel more confident asking questions when something just doesn't feel quite right.
Thanks, Michelle. I think that's reassuring. Nobody is expecting us to become doctors, pharmacists, or nurses ourselves, but understanding the basics and feeling comfortable asking questions can make a huge difference. Something I hear quite often from clients is, I'm not sure if this is my medication, my health condition, or simply getting older. That can feel difficult to work out. How can people recognize when a medication might be contributing to how they're feeling?
That's such an important question, Beck. One of the challenges with medication side effects is that they don't always appear immediately. Sometimes they can develop gradually over time, which makes it harder to recognise that a medication may be playing a role. People often assume a new symptom is simply part of ageing or something that they just need to live with. But there are certain changes that are worth discussing with your healthcare team, particularly if they're new, worsening, or affecting your daily life. Some examples can include feeling dizzy or lightheaded, feeling drowsy or unusually tired, changes in balance or walking, feeling unsteady on your feet, increased confusion or memory difficulties, changes in appetite, constipation, dry mouth, changes in mood, and difficulty concentrating. Now, it's important to say that not every one of these symptoms is caused by medication. There may be a number of different explanations there. However, there are all changes worth paying attention to. One of the things I often encourage people to do is notice what's normal for them. If you've always been active but now feel exhausted halfway through the day, then that's worth mentioning. If you've started feeling dizzy when you stand up, again, that's worth mentioning. If you've become more hesitant walking outside because you don't feel as steady as you once did, that's worth mentioning. Many of the changes we see in healthcare don't happen overnight. They often occur gradually and quietly over time. The earlier we recognise those changes and start asking questions, the more opportunity we have to understand what's causing them and put the right supports in place. I often tell clients that they know their own body better than anyone else. If something feels different, it's worth speaking about. You don't need to wait until something becomes a major problem. Sometimes a simple conversation with your GP, pharmacist, or nurse can provide answers, reassurance, and identify something that can be improved.
That's such an important message. Don't wait until something becomes a big problem before asking the question. And one thing that stood out to me while you were speaking, Michelle, is that one of those symptoms you mentioned, such as dizziness, feeling unsteady, and changes in balance, are all also things we talked about during our falls prevention webinar. It sounds like medications and falls risk can sometimes be closely connected. Can medications sometimes increase a person's risk of falling?
Yes, absolutely, Beck. It's important to remember that medications are often doing exactly what they're meant to do, but sometimes the way they affect the body can contribute to falls risk, particularly in older adults. As we age, our bodies process medications differently. Changes in metabolism, kidney function, and body composition can also influence how medications are absorbed and how long they remain in the body. This means that a medication that worked well years ago may affect us differently as we get older. Some medications may contribute to dizziness, drowsiness, or low blood pressure. Others may affect balance, reaction time, or concentration. When several medications are taken together, those effects can sometimes become more noticeable. The medications that most commonly attract attention from a falls prevention perspective include things such as sleeping tablets, some medications used to treat anxiety, medications that may cause drowsiness, and some medications used to manage blood pressure. That doesn't mean these medications shouldn't be taken, though. In many cases, they provide significant benefits and are an important part of someone's care. The key message is that people should understand how their medications affect them and know when to seek advice if they do notice any changes there. One thing I often encourage people to think about is whether they have noticed any changes since starting a new medication or changing a dose. Perhaps they're feeling a little more unsteady when they're getting up from a chair. Perhaps maybe they're becoming dizzy when standing after sitting for a long period, or they might notice that feeling more tired during the day than they're used to. These are all worthwhile observations to discuss with a healthcare professional.
That's helpful because sometimes people assume that if they're feeling unsteady, the answer is simply to be more careful. But there may actually be underlying reasons worth investigating. Are there particular situations where someone should seek advice sooner rather than later?
Yes, there is. If somebody has experienced a fall, a near miss, or has noticed a sudden change in their balance, mobility, or confidence, that's a good opportunity to have a conversation with their GP or pharmacist. Similarly, if someone has started a new medication and notices significant dizziness, excessive drowsiness, confusion, or feeling unusually unwell, they shouldn't simply struggle through it and hope things improve on their own. Early conversations can be incredibly valuable. Sometimes it may be that a medication adjustment is needed. Sometimes another health issue may be contributing as well. And sometimes people simply just need reassurance and some practical strategies to manage temporary side effects. What we know from research internationally is that falls are rarely caused by a single factor. They are often the result of several small risks occurring together. Medications can sometimes be one of those contributing factors, which is why we regularly review, and that's why it's so important. The goal isn't to stop medications unnecessarily. The goal is making sure medications continue to support health, safety, and independence.
That feels like a much more balanced way to look at it rather than looking at medications as the problem. We're looking at whether they're still the best fit for the person and whether anything has changed. And I think that brings us nicely to a topic that many people have heard about that perhaps don't fully understand, and that's medication reviews. When people hear the term medication review, it can sound quite clinical, but I suspect they're actually one of the most valuable safety checks available. Could you explain what a medication review is and why they're so important?
Absolutely. So, a medication review is really an opportunity to take a step back and look at the full picture. Rather than focusing on one medication in isolation, a review looks at all the medications together and asks whether they are still appropriate, effective, and safe for the individual. As our health changes over time, our medication needs can also change. A medication that was appropriate several years ago may need adjusting. New medications may have been added over time. There may be opportunities to simplify medication schedules or identify medications that are no longer required. One of the things I really like about medication reviews is that they help bring everyone's attention back to the same goal. How can we support this person's health and well-being in the safest and most effective way possible? Medication reviews can help identify potential medication interactions, duplicate medications, unnecessary medications, side effects, medication adherence challenges, and opportunities to simplify routines. For many people, medication reviews also provide reassurance. They create an opportunity to ask questions and understand why each medication is being taken.
That reassurance piece feels really important because I think many people quietly wonder about their medications but may not be sure whether it's appropriate to ask questions. Who should consider having a medication review?
Personally, I think most older adults can benefit from discussing medications regularly with their healthcare team. But medication reviews become particularly valuable when somebody is taking multiple medications, has recently been discharged from hospital, has experienced a fall, has noticed changes in how they're feeling, or feels uncertain about their medication routine. Sometimes family members also notice changes first. Perhaps they've observed increased confusion, fatigue, dizziness, or difficulty managing medications independently. Those situations can all be worthwhile prompts for a review. Importantly, medication reviews aren't about judgment, they're not a test. They're simply an opportunity to make sure medications continue to support the person's goals, their health, and their quality of life.
And am I right in saying this is something people can discuss with their GP or pharmacist?
Absolutely. GPs and pharmacists are excellent starting points. Australia has programs such as Home Medicines Review, where a pharmacist can review medications in partnership with the person's GP and also provide recommendations. People don't need to wait until there's a problem. Some of the best outcomes occur when reviews happen proactively before issues actually arise. The earlier we ask questions, the more opportunities we have to optimise medication management and prevent complications.
That's a helpful takeaway. Thank you, Michelle, that don't wait until something goes wrong, be proactive and ask the question. And talking about asking questions, I think that's another area where many people don't have a lot of confidence. So sometimes people don't know what they should be asking their GP, pharmacist, or healthcare team. Let's talk about that next. Michelle, if somebody listening today wanted to become a little more informed and involved in their medication management, what are some questions they should feel comfortable asking?
I love this question because it reminds people that they are an important part of their healthcare team. People sometimes worry that they're taking up too much time or asking silly questions, but understanding your medications is incredibly important. In fact, I would encourage everyone to stay curious about their health. Some of the most useful questions people can include could be, what is this medication for? What benefits should I expect? How long do I need to take it? Are there any side effects I should watch for? What should I do if I miss a dose? Could this medication affect my balance, memory, or my energy levels? Are there any foods, supplements, or other medications I should avoid while taking it? Do I still need all of my current medications? Would a medication review be beneficial for me? Simply asking those questions can often lead to very helpful conversations.
I find that's really empowering. Sometimes people assume they're expected to simply take the medication and move on. But what I'm hearing is that understanding your medications, asking questions, and raising concerns are actually really important parts of staying healthy.
Yes, one of the strongest predictors of good medication management is understanding why you're taking the medications in the first place. When people understand the purpose behind their medications, they're often more confident, more engaged in their healthcare, and better able to recognise when something changes. And I think the biggest message I'd like everyone to remember from this section is that asking questions is a sign of involvement, not a sign of difficulty. Your GP, pharmacist, and healthcare team want you to understand your medications. Those conversations are one of the best ways to improve safety and support positive health outcomes.
Thank you so much, Michelle. That helps set the scene around why medicines matter and why questions and reviews are so important. Now, I'd like to shift into the day-to-day side of managing medications at home. For many people, the challenge is not only knowing why they take a medicine, it is remembering doses, opening containers, reading labels, organising medications, and fitting everything into normal life. I'd love to bring in our occupational therapist now. One thing occupational therapists are wonderful at is looking at everyday routines and finding practical ways to make tasks easier. So, Katrina, from your perspective, what are some of the common challenges older people experience when managing medications at home?
Thank you, Beth. And hello, everyone. You're absolutely right. Medication management isn't just about health knowledge, it's also about habits, routines, and the practical realities of everyday life. What we often see is that medication management becomes more challenging when several small difficulties start to occur together. For example, someone may have perfectly good memory and understanding of the medication, but arthritis in their hands makes it difficult to open containers. Somebody else.
Sorry, Katrina, I might just, are you able to speak a bit closer to your microphone?
Yeah. Is it better now?
A little bit better. Yeah, thank you.
Yeah. Should I keep going from where I was or start again?
Just from where you were, that's fine. Thank you.
Yeah, let me know if there's any issues with this. Medication management isn't just about health knowledge, it's also about habits, routines, and the practical realities of everyday life. What we often see is that medication management becomes more challenging when several small difficulties start to occur together. For example, someone may have perfectly good memory and understanding of their medications, but arthritis in their hands makes it more difficult to open containers. Somebody else may be physically capable of managing medications, but struggle to read small labels due to changes in their eyesight. Others may have no difficulty opening packets or reading instructions, find it hard to remember whether they already taken a dose. And sometimes life simply gets busy. People have appointments, family commitments, social activities, and everyday distractions. And medication schedules can become difficult to keep track of. One thing I often remind people is that struggling to manage medication doesn't mean you've done anything wrong. In fact, medication management is one of the most complex daily tasks many people perform. It involves memory, organization, vision, dexterity, routine, and attention, often several times every day. The good news is that there are many practical strategies available to make things easier and more reliable. Sometimes the smallest adjustments can have the biggest impact.
Thanks, Katrina. I'm just getting some feedback that it's still a bit tricky to hear you. So I'm not sure if your microphone's on your computer, but if you could just speak a little bit closer to that. Thank you. But yes, everything that you said, it's such an important point. And many of our clients are incredibly independent and capable people, but even small changes in eyesight, dexterity, or memory can make medication management more difficult than it once was. When you're visiting people in their home, what are some of the most common things you notice that make medication management harder than it needs to be?
I've just moved up. Is this better, Beth?
It's still a bit tricky, I think.
Perhaps if you just unplug your headphones and just speak normally through your computer, that might make it a little bit better.
Yeah. Can you guys hear me?
Yeah, that's better.
Okay. I'll just continue. One of the biggest things we see is simply a lack of routine. Often medications are sorted in different locations around the home, taken at different times each day, or linked to routines that regularly change. When that happens, it becomes much easier to forget a dose or feel uncertain about whether a medication has already been taken. We also see challenges related to vision. Medication labels are often quite small and can be difficult to read, particularly in poor lighting. For people experiencing age-related vision changes, even identifying the correct medication can become difficult. Hand function is another common challenge. Conditions such as arthritis can make opening childproof containers or blister packs surprisingly difficult and sometimes even painful. And then there are memory and attention challenges related to age. These don't necessarily mean someone has significant memory impairment. They may simply be juggling multiple medications across multiple times each day. Anyone can become uncertain if they were interrupted halfway through a routine. One of the things we often say is that medication systems should support the person, not rely on perfect memory every day. That's where practical strategies become so valuable.
I love that phrase, that medication systems should support the person rather than expecting perfect memory. What are some practical tools or strategies that can make medication management easier?
There are actually lots of simple solutions available, and often it's about finding the right fit for the individual. For some people, a Webster pack can make a significant difference. Medications are organized into clearly labeled compartments according to the day and time they need to be taken. That reduces some of the guesswork and can improve confidence. For others, a pill organizer may be sufficient. These can work particularly well when paired with an established routine. Technology can also be very helpful. Many people now use phone reminders, alarms, smartwatches, or medication reminder apps. For people who don't use technology regularly, something as simple as a kitchen timer or alarm clock can achieve a similar result. For some people experiencing low vision, there are practical adjustments such as improved lighting in medication areas, magnifiers, larger print labels where available, color coding systems, improved contrast between containers and surrounding surfaces. For people managing arthritis, reduced hand function, or limited dexterity, there are also some very practical assistive devices available. For example, a jar and bottle opening aid that provides large grip and leverage, easy twist medication bottle openers designed for people with arthritis, pill poppers that help push tablets through blister packs, tablet cutters for medications that need to be split, pill crushers for people who have difficulty swallowing tablets where appropriate and approved by their pharmacist or doctor, non-slip mats that can help keep containers steady when opening them. When I visit clients, I often find that something as simple as a bottle opener or pill popper can remove a daily frustration and make medication management much easier. Sometimes we also recommend storing medications in a more accessible location to reduce unnecessary bending, reaching, or carrying. That's the really important thing is that there is no single system that works for everybody. Good medication management should fit comfortably within a person's existing routine and lifestyle.
Thanks, Katrina. That's reassuring because some of those suggestions are incredibly simple. We're not necessarily talking about major changes. We're often talking about small adjustments that make everyday life easier.
Absolutely. Sometimes people imagine they'll need complicated equipment or an early new routine. In reality, some of the most successful solutions are surprisingly simple. I often encourage people to link medications to existing habits rather than creating completely new routines. For example, taking medication with breakfast, after brushing your teeth, or alongside another daily activity can help build consistency. Our brains tend to remember routines more easily when they're connected to something we already do automatically. Again, it's about reducing the effort required to remember. The easier a system is to follow, the more likely it is to work over the long term.
Maintaining independence is something that matters to many people listening today. Sometimes people worry that needing assistance with medication management means they're losing independence. What would you say to someone who feels that way?
It's a really common concern. Many people have worked hard throughout their lives to remain independent and capable. So it's understandable that accepting support can sometimes feel uncomfortable. But one of the ways I like to frame it is support isn't about taking away independence, it's about protecting independence. It's a simple strategy, reminder system. If a simple strategy, reminder system, assistive device, or support service helps someone continue managing medication safely and confidently, then it's actually helping maintain their independence rather than reducing it. We often compare it to wearing glasses. Most people wouldn't see wearing glasses as losing independence. They see it as a tool that helps them continue reading, driving, and doing everyday activities. Medication supports work in much the same way. They're simply tools that help people continue doing what they want to do safely and confidently. Another important thing is to remember is that medication management doesn't happen in isolation. It can be affected by vision changes, arthritis, strength, mobility, balance, fatigue, memory, and changes in daily routine. That's why occupational therapists look at the whole person and their environment rather than just the medications themselves. We're always asking, what's making this task difficult and how can we make it easier?
That's such a practical way to look at it, that medication support should make daily life easier, not make people feel less capable. Thank you so much, Katrina. Let's bring Sharon into the conversation now, because many of the solutions we've mentioned depend on knowing what support exists and how to access it. So Sharon, I'd love to make this real for people listening today. From your perspective as a care partner, what does medication support actually look like in everyday life?
Thanks, Beck. One thing I've learned over the years is that medication concerns don't always look the way people expect. So very rarely does somebody call and say, I'm having a medication management problem. Instead, they might say, I've been feeling more tired lately, or I seem to keep forgetting things, or I'm finding it harder to keep on top of everything. So what we've learned is that medication concerns are often connected to the things happening around a person's daily life, their routines and their circumstances. So it's about understanding what's making it difficult for that person to manage it safely and confidently. So let me share a few examples. So one client I worked with had been feeling dizzy for several months. She knew something wasn't quite right, but she stopped driving and was finding it difficult to get to appointments. Like many older people, she didn't want to burden her family members, so she kept putting off seeing her GP. The barrier wasn't the medication itself, the issue was getting to the appointment. So once we understood the situation, we arranged transport service so she could attend her GP appointment and discuss her concerns. So the conversation led to further assessment and a review of her medications, and over time her dizziness improved and she felt much more confident managing day-to-day activities. So sometimes the support people need isn't medical at all. Sometimes it's helping them access the care that's already available.
I really love that example, because most people wouldn't immediately think of transport as a medication support, but without getting to that appointment, nothing else could happen.
Exactly, and that's why we always try to understand what sits behind the issue. So here's another example, client living very independently. She knew why she was taking her medications and was perfectly capable of taking them herself. The challenge was that her daily routine had changed. Her husband had passed away, she was attending fewer social activities, and many of the routines she'd followed for years were no longer there. She wasn't able to manage her medications. She was simply forgetting from time to time. So rather than taking over the task, we arranged medication prompting as part of her regular support visits. Often it was no more than a friendly reminder, a quick check-in, or a simple conversation. So that small change helped her continue managing her own medications independently while reducing the risk of the missed doses. So one of the things I really like about medication prompting is that it provides support without taking control away from that person. They remain in charge while receiving a little extra help at the right time.
That's a great example again, because it shows that support doesn't have to mean somebody else taking over.
That's right, and often we're looking for ways to help people remain independent for longer. And sometimes family members are the first people to notice that extra support might be needed. So here's another example. Something else that I've noticed is that family members often spot changes before anyone else. So one client's daughter contacted us because she was becoming quite worried. Whenever she visited, she noticed unopened Webster packs sitting on the kitchen bench top and medication starting to build up. The client felt she was managing perfectly well and didn't think it was actually a problem. And honestly, neither person was wrong. So the client was doing their best to remain independent, and her daughter was noticing small changes that were starting to emerge. Now, rather than making assumptions, we brought everyone together and talked through what was happening. The goal was to put in enough support around the person so they could continue living independently and safely. So sometimes one of the most valuable things we do is bring everyone together around the same conversation. Medication management is often strongest when the client, family members, and care team are all working from the same plan and understand how they can all support the person.
That's a really important distinction. The goal isn't always for somebody else to take over, like we mentioned. Sometimes it's simply providing the right support so someone can keep doing it themselves. And I think what we're hearing is that medication management often involves a whole team. The client, the family, their GP, their pharmacist, and sometimes supports around them that they may never have considered before.
Definitely, and that's often where we see the best outcomes. Another common situation we see occurs after a hospital stay. So a client may go to hospital, or they may go into hospital taking a small number of medications and return home with a completely different medication routine. So sometimes medications have been added, some doses have been changed, sometimes medications have been stopped altogether, and that can be quite overwhelming, particularly when someone is recovering from illness, they're feeling tired, attending follow-up appointments, or simply trying to get back to normal life. I remember one client who returned home feeling exactly like that. So they told us they weren't sure they fully understood all the medication changes that had been made and were worried about getting something wrong. So in situations like this, support often means helping connect all the pieces together. We helped coordinate nursing support, arranged follow-up appointments, and worked with the client and their family to make sure everyone understood the plan moving forward. So recovering from illness can be challenging enough without trying to navigate significant medication changes on your own. So having those supports in place helped reduce the stress, build confidence, and allowed the client to focus on their recovery. So hospital discharge can be a time when people are adjusting not only to new medications, but also to new care requirements and routines. Sometimes the most valuable support we provide is helping people feel less alone while all of those changes are happening. Now, one thing I'd like to say is that some of the best outcomes happen before there's actually a problem. We don't need to wait until somebody misses medications, experiences a fall, or ends up back in hospital. Sometimes we notice these small changes first. A person might be relying on notes more than they used to. They may seem less confident with their medication routine. They may mention that they're finding it harder to remember appointments or organise medication repeats. These small changes are often opportunities rather than problems. And if we identify them early, we can explore supports before they become a bigger issue. So that's something we're increasingly focused on at Catholic Healthcare, recognising risk early and putting the right supports around people before a crisis occurs.
That's a useful way to frame it. We often think about support after something has gone wrong, but you're really talking about noticing those small changes early and acting before they become a bigger issue.
Exactly, and sometimes the solution isn't what people expect. So one of my favourite examples involved a client who kept missing medications. So initially everybody assumed the issue was memory. But when an occupational therapist visit, we discovered the client had significant arthritis in both hands. So opening medication packaging had become quite painful and frustrating. Now the client had quietly stopped taking medications because it had become too difficult. Nobody knew. So the solution wasn't a new medication. The solution wasn't more reminders. The solution was understanding what was actually making the task difficult and putting practical strategies in place to support them. So once we understand the real issue, practical solutions were put in place, including assistive equipment and strategies to make medication packaging easier to manage. So the improvement was immediate. The client felt more confident, less frustrated, and was able to manage medications far more consistently. That's one of my favourite examples because it reminds us not to jump straight to the conclusions. Sometimes the barrier isn't memory, sometimes it's vision, sometimes it's arthritis, sometimes it's mobility, and sometimes it's confidence.
I really like that example as well because it reminds us how important it is to understand what's actually getting in the way.
And I think that's probably the biggest message I'd like to give to people to take away today. Over the years, I've seen medication support take many different forms. For one person, it was transport to a GP appointment so they could get help with ongoing dizziness. For another, it was medication prompting that helped them stay independent after their daily routines had changed. For another, it was bringing family members together to create a shared plan where small changes were starting to emerge. And sometimes it's helping someone navigate all the changes that can come after a hospital stay. So whatever all of those situations have in common is that the solution is rarely one size fits all. The right support depends on the person, what's happening in their life, and what's making medication management difficult for them. Medication support doesn't have to mean giving up independence. Very often the best support is the support that helps people remain independent, confident, and in control for longer. Sometimes that's a conversation, sometimes it's a service, sometimes it's a family member, and sometimes it's simply knowing who to call when something has changed. The important thing is that you don't have to do the work. You don't have to work it out on your own.
Oh, thank you so much for that, Sharon. Those examples really show how different medication management can look from person to person. And while medications themselves are so important, managing them well often involves the practical things around them, like getting to the appointments, building routines, adjusting after a hospital stay, involving family members, and finding a system that works at home. So we've received some great questions through the registration process for this webinar. Let's move into our Q&A now and hear from our experts that have joined us today. For those who may not have joined one of our webinars before, you'll find the Q&A button in your Zoom toolbar, usually along the bottom of your screen. If a question comes to mind during our discussion, please type it in the Q&A box. And remember, if you're wondering about something, there's a good chance somebody else is wondering the same thing. So let's get started. If you have any questions, please pop them in. In the meantime, we did have one question that came through during the registration, and it was, if someone uses a Webster pack, do they need written permission from their doctor to change a medication item? Michelle, would you be able to answer that one for us, please?
Thanks, Beck. That's a really important question. Generally, yes. If there is a change to a medication that is packed in a Webster pack or other dose administration aid, that change should be authorised by the prescribing doctor or another authorised prescriber before it's made. Catholic Healthcare's medication management guidance states that medications should not be administered without appropriate written authority. It's also important that the pharmacy is informed, as they may need to update or repack the medication to ensure the Webster pack remains accurate and safe to use. Our guidance recommends involving the GP and pharmacist whenever medication issues or changes arise. If you're ever unsure, the safest approach is to contact your doctor and pharmacist before making any changes. They can provide advice specific to your circumstances and make sure everything is updated correctly.
Thanks, Michelle. That's really helpful and a great reminder that medication changes should always be discussed with the healthcare professionals involved in your care. Were there any other questions coming through? I noticed there was one, a comment that it's very confusing because the same medications have many names. Do you have anything to say for that one, Michelle?
In regards to the medication names, it is confusing. I definitely understand that. However, all of the different companies use a slightly different name. Normally, the beginning of the actual name or the end of it is one that you would recognise. So that's another way to know, but it's probably always good to ask one of the nurses that come to see you or the pharmacist. If you're not sure, make sure that if you are confused, that you do seek assistance from your pharmacist, or pop into the chemist, ask one of our Catholic healthcare nurses, or your doctor. That's the best thing to do.
Amazing. Thanks, Michelle. And I think as well, your questions at the beginning were very helpful on helping, what to ask, and empowering people to ask those questions. So yeah, thank you.
Yes.
We have another question there. When should APO be used as a prefix? Are you able to answer that one, Michelle? Do you know?
APO?
Yes.
So sorry, just to repeat that question again, Beck.
It is, when should APO be used as a prefix?
Okay.
Happy to take that on notice if that's easier, Michelle.
just let me have a look. I won't be a
Yeah, absolutely. No, you're right.
I just want to make sure I'm answering that properly.
Thank you. And I will mention to everyone, I'm not sure if the captions have actually come into effect. I know we had some sound issues there. So hopefully the captions have come onto screen where you can read along with what we're saying. But if not, there will be the recording sent out, and we'll make sure that the captions are added there so you don't miss anything that might have been said earlier. Are there any other questions for our care partner or occupational therapist or registered nurse? We've had a follow-up to that one, Michelle.
Yes.
APO is part of a generic brand.
Yeah, so it is Apotex. So that's normally identifying that it is a generic brand, but it does confuse people as well. So the question was, when should we use it as a
As a
prefix?
Yeah.
For the chemist or for an individual?
I'm not quite sure. I'm sorry. I guess if the chemist is using it and the client sees that.
Yeah, so if the chemist is using it and the client sees that, that means that it's identifying that it's a generic brand.
Okay.
And normally that does come under Apotex. That's like a company that manufactures the generic brands.
Amazing.
It's
Learning
very
so much.
confusing.
This is fantastic. But you see why medication management can be so tricky.
Absolutely.
Yeah, thank you so much for those
Yeah.
questions. And look, if we haven't answered them quite well, we will go away and quite well enough, sorry, and try and put that into a bit more of a structured response for you. But yeah, thank you for that, Michelle.
No worries.
Any other questions there that have come through? I'll ask Beck to have a quick look through there. Otherwise, we might move on now.
Sorry,
Um,
Beck, just
oh,
on that question again.
mm,
Say, for instance, if on the box it says apoamoxicillin or amlodipine or something, that means that it's still got that active ingredient in there, but it's just saying apo because it's a generic brand.
amazing. Okay,
Yeah.
thank you. That's great.
Okay.
Yes, and I know people, the pharmacists might often say, "Are you happy to have the generic brand
Yes.
of that?" Yeah,
Yeah.
that's a nice way of distinguishing it. Thank you. That's
No
great.
problem.
That's helpful.
We did have a question just from an attendee who was interested in understanding how they can make sure their medication list stays up to date when they're seeing different doctors.
Lee, Michelle, are you happy to take that one on as well?
Yeah, so normally your GP is the first point of call. So if you can get an updated medication list from your GP every time a medication is changed or every time you have a new medication, and then I would suggest that if you go and see a specialist then and they're going to add to that, I would write those medications down on your list that your GP has given you. And then the next time you visit your GP, let them know that the specialist has included those particular new medications. And then the GP will update that continuously as well. But
Fantastic.
it's sort of up to the individual to inform the GP when a specialist has added a medication. So everyone is on the same page.
Yeah, wonderful. Thank you for that, Michelle. And yes, wonderful question. Unfortunately, I think that's all the time we have for our Q&A session today. If there were any questions that you submitted through registration or on here that we haven't quite got to, we will put together the responses to those remaining questions and include them in the follow-up email you'll receive probably late next week, along with the webinar recording and any additional resources we've mentioned during today's session. So I hope today's discussion has given you some practical ideas, useful information, and perhaps a little more confidence when it comes to managing medications. But before we finish up, I'd like to ask each of our speakers one final question. So today has covered a lot. So before we finish, I'd like to ask everyone three simple messages to take away, three simple messages from our speakers. So if there was one thing you'd like everyone listening today to remember, what would it be? Michelle, if we could start with you.
Yep, sure. One thing I'd like people to take away today is never be afraid to ask questions about your medications. You don't need to understand every medical term or remember every medication name, but it's important to understand while you're taking the medications that the reason why you're taking them and how they're supporting your health. And if something changes, if you're feeling more tired, more dizzy, less steady on your feet, or simply not quite yourself, please don't assume it's just part of getting older. Talk to your GP, your pharmacist, or your healthcare team, especially if you are seeing any of our nursing team through Catholic Healthcare. It's also quite good to just run it by them as well, and they can also speak to your GP about any symptoms that you're having from your medications. Sometimes a simple conversation can identify an early issue and prevent it from becoming a bigger problem.
Lovely. Thank you, Michelle. That's such an important reminder that you know your own body better than anyone else, and small changes are always worth talking about. Katrina, what would your one takeaway be?
For me, the biggest takeaway is that managing medication shouldn't be harder than it needs to be. We often meet people who think they're just going to have to live with a little challenge they're experiencing. Maybe they're forgetting doses, Maybe they're struggling to open packaging. Maybe medication routines have become confusing or difficult to keep track of, but often there are practical solutions that can help. Small changes can make a surprisingly big difference, so don't be afraid to ask for support if something isn't working as well as it did once.
Thanks, Katrina. That's such a reassuring message again. Sometimes we assume we just have to put up with something because we're getting older, when in reality, there may be a simple solution that makes everyday life a little easier. And then, Sharon, what would you like people to remember?
So just remember from a care partner perspective that the right support can help people stay independent for longer. So don't be afraid to discuss changes that you've noticed with care advisors, with care partners. We can put you in touch with the allied health team. We can put you in touch with occupational therapy, physiotherapy. Reach out to care workers that come and visit. They often give us feedback as well. So just remember you have support there, and we can help guide you in the right direction of where to get help.
Amazing. Thank you so much for that, Sharon. And thank you to everyone. Those three messages fit beautifully together. If there was one thing I'd add, it's that medication management is an important part of maintaining health, independence, and quality of life. And the good news is that you don't need to navigate it alone. Whether it's your GP, your pharmacist, family member, nurse, care partner, occupational therapist, or another member of your healthcare team, support is available. And sometimes asking one question, raising one concern, or making one small change can have a significant impact on your health and your confidence. At its heart, the goal isn't simply taking medicines correctly. The goal is making sure your medications are helping you stay healthy, remain independent, and continue doing the things that bring you purpose, enjoyment, and connection. On behalf of everyone at Catholic Healthcare, I'd like to thank Michelle, Katrina, and Sharon for sharing their knowledge and experience today. And thank you to all of you for joining us and for the wonderful questions you've submitted. As a reminder, you'll receive a follow-up email next week with the webinar recording, answers to any questions we didn't get to during today's session, and some additional resources that might be helpful. And just before we let you go, we'd like to give you a quick preview of some of our upcoming webinars. Each month, we explore a different topic designed to help people stay healthy, independent, and connected at home. If today's webinar was useful, we'd love for you to join us again. You can register through the Catholic Healthcare website. And if you're already on our mailing list, we'll also send details directly to your inbox closer to the date. And again, just before we finish up, if anything we've discussed today has made you think about a support you might benefit from, we'd encourage you to reach out. If you're comfortable using the Catholic Healthcare app, you can request a service directly through the app. Alternatively, you can call us on 1-800-225-474, or have a conversation with your care partner about your goals and the support that may be available to help you stay safe, independent, and healthy at home. We'd be delighted to see you at one of our future webinars. Thank you again for joining us today. Take care, stay well, and enjoy the rest of your day. Thank you.